Have you ever wondered why the doctor who delivered your baby put on special gloves and put them on in what seemed like a very specific manner in comparison to everyone else who just grabbed gloves from the box on the wall? Well, some procedures like childbirth are performed in a more sterile manner than other procedures. In this presentation, I will give you a look at why, when, and how to put gloves on before performing a sterile procedure. We will learn the proper technique for donning sterile gloves for procedures like starting an IV, placing a catheter, or preparing a patient's surgical site before incision. You should then feel ready and comfortable to put sterile gloves on with close supervision. As a surgical technologist, I take great pride in preparing and maintaining a sterile field to ensure our patients and staff stay protected from possible contaminants. Although this is a standard technique for donning gloves in this manner, I am presenting this information to you from an operating room point of view. We will go over the procedure step by step to train and refresh all the operating room staff as well as a variety of students, including you. Before beginning any procedure, ensure that your hands are clean and well manicured. You should not have artificial nails, chipped nail polish, jewelry, or large wounds. Use a procedural hand washing step guide if needed. This information may be easily accessible in your work environment, often near a hand washing station. As stated by Kavnar and Luciano in 2017, hand washing is inexpensive and effective. Proper and timely hand hygiene saves thousands of lives and millions of healthcare dollars. However, despite all of the evidence and reinforcement, effective and timely hand washing continues to be a challenge. You may come across a time when the use of hospital-approved scent-free hand sanitizer may be used if hands are not visibly soiled in lieu of soap and water. However, you should always check with the department educator for specific department facility policies. Our goal with every patient is to do no harm. We want to help them to heal and not add to their condition by introducing a new infection to their list of ailments. The last thing patients and medical staff want is a patient with a hospital-acquired infection. However, this has been and continues to be a big issue and concern. Rules, protocols, and techniques are always being implemented and revised in order to reduce the number of patients who end up with a hospital-acquired infection. Even with the efforts that are made, studies still show that healthcare-associated infections are a major source of morbidity and mortality, and are the second most prevalent cause of death globally. The World Health Organization and other researchers report that 7% of patients in high-income economies and 10% in emerging and developing economies acquire at least one type of healthcare-associated infection, and of these patients, 10% will die. Okay, let's start with selecting your appropriate glove size that allows comfort and movement, but also avoids gloves that are too loose. Gloves should fit snugly. Ensure that the outer package is intact with no damage to the integrity. Look for the indicated expiration date to ensure that the gloves are still within the time frame that will guarantee quality and sterility. In 2002, the Infection Control Nurse Association stated that the aim of wearing gloves is to reduce the risk of cross-infection from staff to patient and vice versa, to reduce transient contamination of the hands by microorganisms that can be transmitted from one patient to another, and to protect users' hands from certain chemicals. The rationale for wearing gloves will indicate the choice of glove required. The process for donning gloves is as follows. You will want to use a clean area that will not be disturbed by others, but is near the area where you will be working. Open the outside package and remove the inside paper-wrapped gloves. Discard the wrapping. Open the inner package on a flat surface, being careful to open along outer folds, and always avoid touching the sterile latex gloves on the inside. Note the orientation of the package. Make sure the writing is right side up to ensure the gloves are facing you, as gloves are specific to right and left hands. Once the paper wrapping is open, ensure that it will stay open and not fold in on itself, leading to contamination. Putting on the sterile gloves. First, with your non-dominant hand, grasp the dominant glove by the inside folded cuff, ensuring you only touch the interior. Next, insert your dominant hand into the glove opening, avoiding contact with the exterior surface. Leave the cuff folded and do not adjust. Using your gloved dominant hand, pick up the non-dominant glove by the cuff. Insert your non-dominant hand into the glove while pulling up the cuff with your dominant hand. Once both hands are gloved, adjust slightly while maintaining sterility, ensuring no contact with non-sterile surfaces. Upon completion of the procedure, remove your gloves in the following way. With your dominant hand, pinch the wrist of the non-dominant glove and pull downward to remove it. Hold the removed glove in your dominant palm. With your bare, non-dominant hand, slide 2 fingers under the glove cuff and pull it downward, inverting it inside out. Dispose of the gloves properly and wash hands with soap and water or hand sanitizer. After reviewing these instructions, viewing the presentation, and practicing the techniques you have learned, you should be able to perform the sterile open glove technique with accuracy. This technique can be used to do sterile exams, prepping a patient for a procedure, catheter insertion, dressing changes, and many more situations. When first learning this technique, you should always be guided by a preceptor. If you want to do a clinical rotation in the operating room, do not be afraid to ask for help and feedback. The operating room can be an intimidating, confusing, and scary place, but the staff are well trained when it comes to sterility and are always happy to teach. Informing the staff that you are new and would like guidance will always be better than risking contaminating someone or something. Bree Williams and Waterman in 1996 found that 33% of nurses contaminated their hands and equipment during the aseptic technique procedure, due to factors such as poor glove technique and making the procedure more complicated than necessary. You should look up the current data. Do you think we've improved over the years? Remember, sterility is black and white. There is no gray area. A good surgical tech once said, "If you think it's contaminated, it's contaminated." Don't be afraid to speak up. If you see something, say something. You are your patient's advocate. Their safety is always our top priority.